This is Alana Stimes, the Director of Program Development, and I'm going to give you a high-level overview about the Recovery Corps program. So, Recovery Corps was created because at the national level, opioid use disorder has increased at an alarming rate, especially over the past few years. From 2010 to 2019, the number of Minnesotans specifically who died from opioid overdose grew by 87%. And we know that the COVID-19 pandemic has increased kind of overdose issues and for folks who have experienced substance use disorder as well. So really, opioid-related deaths have been the leading cause of drug-related deaths in Minnesota and nationwide, leading us to think about how AmeriCorps can be used as a resource to support a recovery-oriented system of care. We've built this with Recovery Corps here in Minnesota, and the success of our program model has gained national attention as a potential resource for a strong existing infrastructure. AmeriCorps is a great fit, especially for a Recovery Corps program supporting a recovery-oriented system of care, because AmeriCorps is a human capital solution that's rooted in service to others. So it's a natural fit for recovery communities that place a high emphasis on serving the community once you're a person in long-term recovery. So the vision is to provide support through AmeriCorps members that provide capacity building support of the community plan in place. Recovery Corps focuses on assisting people in recovery from substance use disorders who are in need of extra supports to build their recovery capital. It could be things like employment, education, training, or connecting back to the community through service. We train our Recovery Corps members with things like motivational interviewing, the Recovery Coach Academy, resource navigation, and action planning. And we really work to build kind of on those one-to-one relationships with the folks that we serve. So our navigators, our recovery navigators, conduct interest and needs assessments and provide individualized planning and support in kind of 4 different areas of what we call recovery capital, or the supports that people have available to them to help them build a healthy and successful life in long-term recovery. Recovery capital can include things like social capital, like family, friends, community relationships, physical capital, like property or money, cultural capital, helping people identify their values and strengthen their beliefs and social attitudes, and then human capital, skills, positive health, aspiration, and above all, that feeling of hopefulness. Our goal in Recovery Corps is to increase the folks that we serve, increase their recovery capital. Again, these supports that folks need to build that healthy life and recovery, and ultimately reduce kind of recurrence, or what sometimes people refer to as a return to use, and really help people build that strong and consistent healthy life in recovery. So we have 2 different member positions within Recovery Corps, and I'm going to tell you a little bit about our recovery navigators first. Our recovery navigators are AmeriCorps members, and they serve to provide mentoring regularly, and in a recurring way, so not just walk-in, but more than one time with the populations that they work with. They provide individualized planning, support, goal setting, and action planning, and they really work to meet the immediate needs of participants, as well as provide resource navigation, connecting folks with what they need most at that moment that align with their long-term goals. And then we really help them, again, kind of attain their goals. Maybe it's identifying that service opportunity, helping them get some skill building that they need, employment, it could be safe housing, other types of different goals that our participants might have. And really, that's all providing these services to folks who are in recovery from opioid use disorders or other substance use disorders. We also have a second position within the Recovery Corps program called Opioid Response Project Coordinators. And the main beneficiary of these individuals isn't necessarily a person, but it's the service site. So our AmeriCorps members serve as opioid response project coordinators helping the service site increase their capacity, being able to reach more people in the community, improve programming, improve research or data analysis, and kind of their wish list that they have in order to kind of provide that systems change that we're looking for within our communities to better respond and address substance use disorders in general, as well as the opioid epidemic. We definitely measure what we do in our program. You'll notice that that's a pretty common theme across all of our programs here at our organization. We have recovery navigators, and these folks really do some great data collection. For the program, they report on the number of individuals who are served, and then the number of individuals who do report that increase in their recovery capital. And we use a special assessment called a BARC 10 assessment to kind of address that data collection need. They also collect robust demographic information. Our opioid response project coordinators, they fill out a work plan at the beginning of their service term in collaboration with their site, and then they report against that work plan quarterly, kind of letting our program know a little bit more about how that site has increased its capacity. And so it's kind of reporting on the number of host sites that report that increase in capacity. And it can be a variety of different things, like increased collaborations with other organizations, maybe increased communications and marketing, being able to reach more communities and let more folks know about programming that's available. We have several of these folks who help build training curriculum or create new systems. They're responding to workforce shortages and increasing demand for services, or maybe even evaluating program effectiveness. It varies a lot site by site, but we still really work to capture the effectiveness of the program and then really capture all of those great stories that we know the program works. We definitely train all of our Recovery Corps members so that they're well prepared for the service that they do. Our recovery navigators really work directly with individuals, building those trusting relationships and helping guide them along their recovery journey and building that recovery capital, as I mentioned earlier. And so we provide all of our recovery navigators Recovery Coach Academy training that provides them with the necessary skills and hours to meet competencies that's required for peer support certification where they're serving. We also have a proprietary Recovery 101 training that gets a little bit deeper into the history of substance use disorders, brain development, recovery terminology, and a variety of other great topics that we know that our recovery navigators need to know more about. We've also built a recovery career and life skills training that's new in the 2020 program year that helps our navigators prepare for a career in the field and build a little bit more of those hands-on skills like setting good boundaries with clients, digs a little bit deeper into ethics, and then definitely addresses important things like self-care and burnout. Everyone's trained in AmeriCorps requirements. All of our navigators are trained in motivational interviewing training, which helps them know great skills to be able to build trusting relationships with the individuals they're serving quickly. We train everybody in diversity, equity, and inclusion, and then we offer core days for all of our members to continue their learning cohort together and build additional professional development skills throughout their service term. For our opioid response project coordinators, they are also trained in a variety of great topics, many of which are the same as our navigators, but some are different. Since our project coordinators aren't necessarily serving people directly the way our recovery navigators are, we want to make sure that they're trained in topics like stakeholder engagement, being able to communicate effectively with key constituents on a project. We train them in research and data collection knowledge. And then we partner with the University of Minnesota to be able to provide a customized project management training just for them to help them build skills and understand how to best implement a work plan from start to finish. They're also trained in Recovery 101, AmeriCorps requirements, diversity, equity, and inclusion, and core days, as I mentioned earlier. Our site partners in Recovery Corps are a mix of nonprofit treatment centers, collegiate recovery communities, recovery high schools, recovery residences, recovery community organizations, drug courts, harm reduction organizations, social service organizations, and state and local agencies. So we're really excited to be able to have a model that's effective across a variety of very different organizations. And we really focus on serving folks who are in early recovery, who are kind of still working on stabilizing, meeting basic needs, and rebuilding life skills. They just need that extra support and that extra person with lived experience. I should mention, I don't think it says it anywhere in these slides, but our recovery navigators specifically are people who identify as individuals who are in long-term recovery from substance use disorders. And that's really essential to our peer support model. They have to be in recovery because they understand what that recovery journey is like, and they can bring that peer aspect and coaching to the folks that they're working with. The Recovery Corps program makes an impact. As you can see here on this slide, we see so many of our participants year after year who increase their recovery capital score, and that's the goal of the program. You can see they make a huge jump. And our project coordinators likewise are making huge impacts with the sites that they're placed at. 100% of our host sites report that their member really helped them build capacity that they were aiming to increase. And it can include so many different things like I mentioned earlier. For our recovery navigators, we can also see that our participants served by a recovery navigator increase their recovery capital over time. You can see that kind of percentage increase from someone who's been seen 2 times by a navigator in contrast with someone who's been seen 6 times by a navigator jumps substantially. So we know that customized one-to-one peer support by a navigator can make a huge difference in somebody's recovery journey and overall kind of increasing of that recovery capital. Lastly, we're excited to report that our program has a big impact on the members who serve within it. So if we're having our members really kind of provide these great services, we want to make sure our program is also providing really great supports for them as well. And so for navigators, their own recovery journeys are strengthened through service with our program, and they've experienced personal growth in recovery capital, quality of life, self-esteem, and self-efficacy after their service term. Lastly, I'll just note that we are working on replication efforts of the program. So Recovery Corps has been around since 2017, so just about 5 years coming up in 2021. And in the fall of 2021, we're excited to announce that we're expanding into Illinois, hoping to place about 30 Recovery Corps members on the ground all across the state, everywhere from kind of the Cook County area and then all across the state in a variety of different counties statewide. So more soon on how that's going. And for more information, you can go to recoverycorps.us and learn all about our efforts both in Minnesota and Illinois.